On behalf of the Center for Primary Healthcare and Equity, I welcome to all of you for this online training on healthcare navigation. The training consists of 10 modules, and this presentation covers Module 1, which is on the health system and general practice. So after this module, you will be able to learn about health system in Australia, general practice, providers of healthcare cost, primary health networks, aged care services, a National Disability Insurance Scheme, NDIS, interpreter services, and we will end up with some of the reflections of this module. So the Australian health system offers many services, including prevention in the community and general practice, community health nursing, emergency health services, hospital care, rehabilitation, and palliative care. And the health system is funded by Australian and state governments, private institute, and patients. The health workforce in Australia includes surgeons and medical specialists, nurses and midwives, dentists, allied health practitioners, general practitioners, and other support staffs. So there are 3 levels of healthcare services in Australia: primary care, secondary care, and tertiary care. As you can see, the size of the box depends on the size of the patients that are being served. So the primary care received the major portion of the patients, followed of secondary care and tertiary care. General practice is the first level of contact for the people with the health system in Australia, and it is the level at which most health problems are identified, managed, or referred. General practice focuses on protecting and promoting the health of the people in communities. They care for patients of all ages, both sexes, children and adults across all disease categories. Practices are consisted of general practitioners, nurses, administrative staffs, and most of the practices in Australia are small, with 1 to 5 practitioners. So the Medicare is the government's universal insurance scheme in Australia, and it covers hospital costs, all or some of the cost of general practitioners and specialist consultations, cost of some laboratory tests and clinical examinations. It also provides reduced cost of some prescribed medicine through the pharmaceutical benefit schemes. While the private health insurance is an optional cover to provide private hospital cost, extras such as dental, optical, and physiotherapy treatments, and ambulance cost. The primary health networks support community health centers, hospitals, general practitioners, nurses, specialists, and other health professionals to help improve the patient care. They coordinate different parts of the health system and assess the health needs of their local area as well. Further, they also fund other organizations and provide extra services that are needed. Meanwhile, the translation and interpreting services is an interpreting service provided for people who do not speak English and for agencies and businesses that need to communicate with their non-English speaking clients. So the TAS National has access to interpreters across Australia who speak more than 160 different languages and dialects. TAS services cover immediate phone interpreting for non-English speakers, an automated voice prompted immediate phone interpreting services, a pre-booked phone or on-site interpreter, and irregular maritime arrival interpreting as well. To access leave, an employer may require the employees to give evidence of the reasons for the leave, and this is usually a medical certificate. Rules for issuing a medical certificate can be outlined in applicable industrial instruments or employment policies and can vary between employers and situations. And general practitioners frequently receive requests from the patients for the sickness certificate. The practitioners may also be asked to verify by the employers whether a sickness certificate is bona fide or not. The Australian health system also provides some other services such as community health services, which employs nurses and allied health professionals to provide care in community, emergency care to diagnose and treat acute and urgent illnesses and injuries, aged care package that funds home care workers and support to help old people stay at home, and National Disability Insurance Scheme that provide all people with disability with information and connections to services in their communities such as doctors, nurses. Now, we would like to have some of your reflections of this module. Please follow this link to access the reflection form. And here ends the module 1. Thank you.